My name is Dr. Matthew Opalak. I'm board certified in family medicine. Today I'm going to discuss primary hypertension. Hypertension is a global health concern, and in the United States, it is the leading cause of office visits and the most common reason for the use of chronic prescription medications among non-pregnant adults. Approximately half of the individuals with hypertension struggle to achieve and maintain adequate blood pressure control. Normal blood pressure is a systolic of less than 120 millimeters of mercury and a diastolic less than 80 millimeters of mercury. Elevated blood pressure is a systolic from 120 to 129 millimeters of mercury and a diastolic of less than 80 millimeters of mercury. Stage 1 hypertension is a systolic of 130 to 139 millimeters of mercury or a diastolic of 80 to 89 millimeters of mercury. Stage 2 hypertension is a systolic of at least 140 millimeters of mercury or a diastolic of at least 90 millimeters of mercury. Out-of-office blood pressure measurements, including ambulatory blood pressure monitoring and home blood pressure monitoring, are crucial for diagnosing hypertension. Ambulatory blood pressure monitoring is considered the gold standard for out-of-office readings. However, home blood pressure monitoring is the initial approach for most patients. Hypertension is diagnosed if the mean home blood pressure is greater than or equal to 130 millimeters of mercury systolic or greater than or equal to 80 millimeters mercury of diastolic. If out-of-office confirmation is not possible, serial office-based blood pressure measurement can be used with the same criteria. Hypertension can be diagnosed without further confirmatory readings in specific scenarios. These scenarios include hypertensive urgency or emergency. If the blood pressure is greater than or equal to 180 millimeters of mercury over 120 millimeters of mercury without any signs of end organ damage, that is considered a hypertensive urgency. If the blood pressure is greater than or equal to 160 millimeters of mercury over 100 millimeters of mercury with signs of end organ damage, that is considered a hypertensive emergency. What causes primary hypertension? While the exact cause of primary hypertension remains unclear, there are a number of risk factors that are strongly associated with developing primary hypertension. These risk factors include advancing age, obesity, family history, race, kidney disease, high sodium diet, excessive alcohol consumption, physical inactivity, insufficient sleep, and social determinants of health, such as low socioeconomic status and lack of health insurance. Hypertension significantly increases the risk of adverse cardiovascular and renal outcomes. Complications include left ventricular hypertrophy, heart failure, heart attack, ischemic stroke, intracerebral hemorrhage, and chronic kidney disease and end-stage renal disease. Non-pharmacological treatment of hypertension includes dietary salt restriction, potassium supplementation, weight loss, the DASH diet, regular exercise, and avoidance of alcohol. First-line pharmacological treatment includes medications such as diuretics like hydrochlorothiazide or chlorthalidone, calcium channel blockers like amlodipine or nifedipine, angiotensin-converting enzyme inhibitors, also known as ACE inhibitors, like lisinopril or benazepril, and finally, angiotensin receptor blockers, also known as ARBs, like losartan or olmesartan.